Welcome to the Luke Coutinho Show, where we can learn to reimagine our lifestyle.
Welcome to Reimagine Your Lifestyle. Today we have a very special guest, Dr. Sonali, with us. It's a pleasure and privilege to have her on our show to talk about skin, hair, and human life. There are so many myths out there. Today you may be a teenager watching this program, worried about your acne, but you're consuming the wrong content or reel after reel that's telling you what you should do. Like there's this tea, there's this cream, there's this magic food, and you waste so much time without actually addressing the root cause of your problem. And then we have women and men across all ages who have hair fall problems, thinning of hair, skin problems, and there's the right way of doing it and there's the wrong way. And that's why on our show, we always have experts who can come and break myths and empower us with a new thought process so that we can help address our problems at a root cause level. Dr. Sonali, thank you so much.
Thank you so much,
It's a pleasure.
Luke. It's my pleasure, totally. And thank you so much for having me. Firstly, thank you for coming out there and bringing out the real fact and the importance of how food can impact you as a person and definitely impact your skin. Have to be grateful to people like you who are sharing this knowledge and making it available for people, because sometimes as a doctor or as a dermatologist you can fall short in doing that, because when people come to us, they expect you to give the one answer, which is just tell us the regime and make my skin look beautiful. And it gets hard to explain to them how important it is to have a good lifestyle and how important it is to have a good diet in place, because as I look at it, skin is completely internal. It's not just what you see. It is your largest organ, but it's impacted by everything that you eat and put on it as well.
Doctor, that's the reason you're on the show. I love your work because you don't just talk about creams. You just don't talk about medication. You talk about that, which is important. In many cases, it can solve a lot of problems, but you also encourage people to change their lifestyle, to address the root cause of the problem. And I love your perspective on inside out. I mean, what happens on our skin is a reflection of what's happening inside most of the times.
Totally.
So doctor, in your experience, I'd love to start from the beginning. How come you moved into being a dermat? How come no other field of medicine? Tell us about your story and what led you up till now.
Honestly, I come from a completely medical background. So becoming a doctor was what I've always wanted to do since a child. But to start with, I always wanted to do cardiology.
Okay.
And then I realized that, I don't have the strength to lose a patient. And I wanted to be there to change their life, but I wanted them to also be able to live through it. So I wanted to do a profession where in no way would I ever have to go through that loss. And I think dermatology became one of the most easiest ways to be able to incorporate medicine and still do it in a very aesthetic manner. Because as I said earlier, and I always say this, that I know skin looks very superficial, but it's one of the first organs to show you when there's something going wrong in your body. So the first sign that you'll see is always on your skin of an internal battle which your body might be fighting. And I think that's what led me to dermatology. And then over the years, I realized that, of course, in certain cases, medication is everything. And it's going to be your first step to help the patient. But over the years, I started realizing how much of a role it played to understand the systemic cause of it, to understand where it was initially happening. Like if you have acne, what could be the cause of that acne? Whether it is your diet, whether it's an hormonal imbalance that your body is trying to communicate to you. And that led me to this functional medicine program, which I started studying and trying to understand how I could incorporate the pillars of functional medicine, that is understanding the root cause, to actually give you a healthy glowing skin that's sustainable and that a patient can live with their whole life.
No, that's beautiful. I want to pick up on the point where you spoke about how our skin is a reflection of what's happening inside of the body. So in lifestyle medicine, that's exactly what we call biofeedback.
True.
And sometimes by just looking at the skin of a person, it tells you what's happening. Is there a gut problem? Is there a deficiency? Even a deficiency of one particular vitamin.
Yes.
I love what you said about the pillars and understanding the root cause, because today, we live in a generation where everyone wants a quick fix and instant gratification. They don't even want to understand, why do I have acne?
True.
Because sometimes medicine can't fix what deep sleep should do, or correct nutrition.
True.
And sometimes deep sleep can't fix what a medicine can do. But you need to understand what the root cause of the problem is. So that's amazing.
So it's very important what you said, Luke, because when I talk about pillars, the first pillar in my practice I feel is gut health, because all roads eventually lead to gut.
True.
And if you go to see, I like to refer to the gut as everything that comes in your abdomen. So I'm just not saying look at your stomach and your small intestine and your large intestine where your food is digested, but also look at the health of your liver, because that's the organ that's detoxing your body.
True.
So the stress that you expose it to in terms of your diet, the toxins, because we all sometimes make certain lifestyle choices which might involve smoking, excessive alcohol consumption, other stuff which is just not good for you, is stressing the liver, and this is your powerhouse. And for females especially also, it's a major place where you're detoxing your hormones. So if your liver is not supported, it's going to show on your skin. And if you go to think of it, what I'm saying is not something that hasn't existed for ages. Our grandmoms, our earlier people have said, oh, if you're having acne, you're probably not going to the loo properly. You're not pooping enough, right? That's the first thing. Now, if you just think about it, what is the correlation between poop and acne? It's a direct link. That's how the gut-skin axis has always existed. It's just being flagged out now. So it's becoming a new thing. And I often say this, and I was discussing this with you, is about this soundbite nutrition, this new trend which comes. You see one reel, like you said, and it says, this is good for your skin. This is an instant fix for your skin. Drink black coffee, it's antioxidants. People need to know what they are putting into their body and whether your body is accepting what you're putting into it.
Exactly. Yeah, no, I love what you say, because that's the problem today. And the reason why we do this show, Dr. Sonali, is because there's too much of content out there.
True.
Some of it is great, but a bigger problem is, like I always do this test with people, how many reels did you watch today? It's about 9, 10. What did you remember? They don't remember one thing.
Yeah.
It's just going through the mind, dopamine, picking up nothing, but you're picking up keywords. Oh, I like coffee. Someone said coffee is great for skin.
True.
Let's have it. And they speaking on the coffee thing, yes, coffee does have liver protective, properties.
Yeah, I agree.
Great but not for everyone.
Not
a
for
patient
everyone.
of thyroid. Doing excessive black coffee will actually create more problems, which will, show up on the skin.
It's so important what you say. And also, see, we all know that intermittent fasting is doing the rounds, right? And it's great. And I also feel that if it's suited for you, it will help your skin. But what also people don't realize is they are starting their day as the first thing is with coffee, right? Like a black coffee. And I'll tell you why I say this, why it's relevant to my practice, is that because that black coffee in the beginning could actually be causing your insulin spike. And now with this whole biohacking, you can actually measure it. You can see that insulin spike. Now, insulin is everything with your skin. Acne is because of your insulin spikes. Hair loss is very correlated with your insulin spikes. Truncal acne, again, insulin spikes. Hirsutism, over hair growth, excessive male hormone in the body. This is all correlated with your insulin. So people tend to think that, oh, let me take a fixed pill, right? Like, you have PCOD, let's correct it with a contraceptive pill. What you really need to understand is what is going on in the body and why is that happening? Why do you have more male hormone than a regular body should have as a female? And how can you help it reverse? Yes, some cases medication is absolutely must. But in a longer scheme of things, what you're providing in terms of your nutrition, the lifestyle that you're doing can actually completely shift your roadmap. So you control your blueprint.
Absolutely. I want to go back to that coffee point because, you have a lot of people who just blindly follow Instagram and certain cultures around the world. And you would be saying, how can coffee create insulin spikes? Put on a CGM monitor and you'll be surprised how many people. Now you'll be saying, oh, but it's not a carbohydrate. It doesn't have to be. Coffee will boost adrenaline and cortisol levels in an already stressed out body that wakes up with excess blood sugar. That's enough to create a spike in the body. So everyone's different, because a lot of people assume that, oh, it doesn't have a carb. How can it spike? When you put on a CGM monitor, like you said, everybody's different. Some people spike with oats. Some people spike with fiber.
Exactly. And I'm so glad you said this because most people have that first cup of black coffee because you feel fatigued when you slept at night. So in the morning, it's exactly what you said. It's giving you that spike. It's shooting your dopamine, which is what is getting you addicted in the first place. So I'm not saying coffee is not good. Coffee is a great antioxidant, but maybe it's not the best thing to have first thing. Have it after your breakfast so that you can have a lower insulin spike through the day. Same thing goes with apple cider vinegar, right? I agree. Vinegar is great and it's also shown benefits for your skin because it balances the pH in your body, right? Now again, as I said, the soundbite nutrition of pH of the skin. You need to understand the pH of the skin is different. The same things that you apply on the skin to balance your pH is not going to be enough if the pH of your body is not balanced.
True.
So if your pH is not balanced in your gut, you're not digesting half of the supplements that you're popping in, be it your collagen, which is the latest rage, be it your turmeric, which everybody thinks, and I agree, is a great anti-inflammatory supplement. But you need to understand that you have to optimize the absorption of these things, and this is what gets very difficult, because you pick one supplement and then you pull through, like biotin for hair.
Yeah.
It's not going to work
Doesn't
for
have to
everybody.
work,
You
yeah.
should have a biotin deficiency for biotin to actually help your hair loss.
True.
And you'll be shocked at how many people actually just get help with taking a vitamin D and optimizing a vitamin D, and you'll solve your hair follicle problem.
Yeah.
You know, so you can simplify your life. You can simplify having good skin and good hair.
I love what you said about vitamin D. A lot of people see it as only the sunshine vitamin for bones.
True.
But today we know it's one of your you need it for hormones,
Yes.
which in turn is connected with your skin and your hair. Going back to apple cider vinegar as well. When people look at it through the lens of, oh, apple cider vinegar helps me lose weight. That's where the problem is. It isn't that. It has such a scientific role in the human body. And I love what you said about pH being different. Our skin has a different pH. Our stomach has to have a different pH. Every part has a different pH for its relevant functions in the body. But your people are trying to be either all alkaline, which is actually making it worse for your scalp and your skin and your gut.
Yes.
And the point that you spoke about, fasting again, it doesn't suit everyone.
No, it doesn't.
You know, I mean, fasting originally was what is the gap between my meals? And then between my last meal and breakfast, which could be 12 hours. For some people, that's more than enough. Some people can push on to 16, but some people have put themselves into this box. I do a 16-8 without even asking, why not 15? Why not 17? Why not 12? Is it suiting me? And then they're starving themselves and creating a bigger issue.
You know, Luke, I'm so glad. And I know this might be too scientific, but I feel this is the only way I want to put my content out there for the consumer. And you know, when we talk about fasting, we need to know why, right? And again, I'll bring it back to skin because that's how it's correlated. You have these powerhouses in your body, and these are called your mitochondria, right? This is where you're producing all your energy. Now, every time you give your body glucose, your mitochondria is supposed to help you break it down. When I give it excess of it, my mitochondria can't work, right? And the minute that happens, it spikes my insulin. Now, insulin is also responsible for causing your aging. It's one of the biggest, your insulin spikes is majorly responsible for how your organs age, but also how your skin ages. Because we're all going through something which is known as glycation. So I'll give you an analogy. You know how a chicken roasts in an oven? So when you start roasting it, it's nice and pink and then it gets brown. That's how you age. When a child's cartilage is there, it's pink. By the time you die, the cartilage has become brown because you're going through this whole glycation with your environmental stress, your toxins that you expose to your body, the stress of the food that you give your body, and of course your hormonal factors. And all of these is shocking how correlated it is to sugar. So as a dermatologist, when I talk so much about insulin, dairy or sugar, there's a reason. I'm not a nutritionist, that's not what I do, but there's a correlation, and if that correlation was just understood, I'm telling you, you'd be shocked about the number of cases that would just be able to have healthy skin. You know, like it was before. People say my grandmom never had acne. Yeah, because they didn't eat the foods that we are eating. They lived a very different lifestyle than what we are living today.
The way they handled stress, they didn't have stress.
No.
But they had a very different perception towards handling it. They accepted a lot of it, let go of what they couldn't control.
It's what you said, right? Look, like you said about sleep. You have to see the kind of things urbanization has brought us has really taken us away from our roots. There was a reason your body has a circadian rhythm. I tell my patients, everybody knows this. You need to sleep for good skin. Nobody cares about what I'm saying when I'm saying sleep, right? They say, she said sleep 8 hours. I'll sleep at 2 in the morning. I'll get up at 10. I've covered my sleep, doc. I slept. No, you didn't. You need to follow the body's circadian rhythm. You need to go to bed so that your body can produce the growth hormone when you're sleeping. And that is exactly how you're aging. But people think I'll lather my skin with hyaluronic acid. I'll put my retinol. And I'll sleep at whatever time I want and I'll get up at whatever time I want and my skin should still look radiant. I can't do that. There is no quick fix. You need to sort of reset and replace your life with certain good things for you to have healthy skin. That's the only truth behind it.
And that's why you're the best at what you do, doctor, because you speak honestly.
Yes.
And the point is like collagen, like you said. We have so many patients and there's structural collagen, which only sleep can fix. like you rightly
You are
said, when we
absolutely
sleep.
right. You need that because that's when your collagen is building.
Yeah.
And the more you stress your body, lack of sleep is a stress signal.
Mhm.
You are breaking down your collagen. You are aging
And the powders
faster.
can't fix that part of it.
No.
Now, I would use collagen for patients who have gone through a hip replacement, cartilage, all of that to
True.
support.
True.
But structural collagen of the face is dependent completely on sleep, which is why I guess they call
I'm
it
so
beauty
glad.
sleep.
Yes, I'm so glad that you brought that
Yeah.
out because you're right. For the joints, you need a very specific type,
Yeah.
right? You need your GAGs, your glycosaminoglycans, you need
Yeah.
your proteoglycans. Yes, those can be supplemented. But is that really supplementing for your skin?
Yeah.
No. Rather, go on an amino acid rich diet, eat
True.
good protein, take an
Mhm.
amino acid supplement.
Yeah.
That will help your skin and hair.
Yeah.
You know,
And mitochondrial function, improve that.
improve your
Yeah.
mitochondrial function, take mitochondrial support,
Mhm.
you know, and it's simple. Just eat vitamin C, eat vitamin E,
Mhm.
take a B complex. And
Mhm.
sometimes, you know, patients tell me, doc, why do I have to take these supplements?
Mhm.
What I need people to understand is that sometimes the way we cook our food, the
It's
choice,
depleting nutrients.
yes,
Yeah.
it's
And even the
depleting
quality
nutrients.
of food.
Yes.
Spinach isn't the same it was like 15
Exactly.
years ago.
Exactly.
The soils are depleted. So
Yeah.
we need to sometimes
I read a
supplement.
very interesting article and it said the bananas which existed before, if you compare them to now,
Mhm.
those are actually filled with seeds, much smaller in size and
Mhm.
not at all what they look like today.
Okay.
So you need to understand, as humans, we've genetically modified everything.
Mhm.
We've managed to breed wolves and produce a breed of dogs. So you need to understand what we've done with our food as well, right?
Mhm.
And we all live in this urbanized world, which we can't take away. But what we can do is just consume the right supplements, supported with the right diet.
Correct.
I don't think one can replace the other.
Mhm.
And of course, follow a good skincare regime. Having said all this, I'm not saying a skincare regime is not important, which brings me to the popular Korean 9-step regime, which all of us being Indians living in this climate are trying to follow.
I know people who sacrifice their sleep to get the 9-step regime in
I'm
place.
sure it's so tedious. I don't even know how anyone attempts it. But this is the thing. Koreans have a very different genetic system.
Yeah.
They are born with a certain skin type.
Mhm.
And if you go to see their diet, it is completely a 360 of what Indian cooking looks like.
True.
Their food is as uncooked as it gets because it's steamed. The vegetables they consume,
Fresh. Yeah.
fresh, and they have so much fermented food,
Mhm.
right? But their gut and their body is suited to that.
Mhm.
So their skin looks a certain way. Korea climate is very different from Indian climate.
Mhm.
So following a 9-step routine there actually helps you to trap that moisture into your skin.
Mhm.
In India, especially in a city like Bombay, you don't need to trap the moisture. There is enough humidity in the environment. You are actually making it worse for your skin by putting these layers because you are giving the allergens a base to come and stick to you.
Mhm.
Everybody knows when you put oil on your skin, you will find that dust and sand sits faster, right? You're living in a city with an AI index which is
Yeah.
insane. It doesn't match to the
Dangerous,
AI
actually.
index
Yeah.
of Korea.
Yeah.
So you need to understand that your skin has to use products which are suited to your environment.
Mhm.
And that is a very basic rule. I can't lather humectants which are sealing in the moisture in a weather where it doesn't need to be entrapped.
Mhm. Right.
I'm confusing the skin. I'm
So the skin
confusing
needs
the
to breathe
pH.
in this,
Yes.
literally breathe in this
Yes.
way. Yeah.
In fact, where we stay, our skincare should be as minimum as it gets. What we really need to work on is, in fact, cleansing. We need to use cleansers to make sure that the pH of our skin is balanced. Because of the pollution in the air, we are ripping our skin of the moisture. So you need to hydrate it internally with what you eat and drink, as well as externally.
Mhm.
Because that's what the environment in this city needs, or that's what the environment in general needs in India with the kind of pollution that we're all exposed to.
Wow, that's super helpful. Since we're on that topic of skin and moisturizing, when it comes to sunlight, what's your take? Now, I know, see, we have a lot of autoimmune patients, eczema, psoriasis. Some of them, the sun works brilliantly. Some of them, no, absolutely not. They can't do that. But the early morning sunshine, for people who don't have a condition, okay, do you really have to wear sunscreen, or, what's the whole sunscreen thing? Because I've seen two categories of
Yeah.
people. We fortunately have a global clientele. We have people in Australia where everything's questionable, the ozone, all of that stuff.
True.
But the early morning sunshine versus, of course, if I'm stepping out in the harsh sun, I'm going to be on the beach at noon, I definitely want to protect my skin because of the ozone and the rays that should not be hitting our system, which we were once protected with because of the ozone,
yeah.
which we don't have. I'd love for you to explain the whole sunscreen thing and where does it find its place in our skincare protection, and can we actually get through the 7:30 morning sun without that to at least
True.
absorb most of the rays?
I'm so glad that we're talking about this because, I feel there's a lot of myth which exists. And as I said, I need to explain a little context to this because I want the people to understand why I say this.
Yeah.
We all know that when you're exposed to the sun, vitamin D is produced. So let me simplify this. The skin cells are what are making your vitamin D. They are the only cells in the body which are metabolizing your vitamin D and giving the whole body the active version of it. Having said that, when you said about psoriasis, Luke, one of the best therapies which was seen was in earlier times when so many steroids and all didn't exist in the pharmacy industry was people, when they went to the Dead Sea, for psoriasis and eczemas, it was actually considered a treatment. It was a treatment to make that visit. Now, why that happened is because there was a narrow band therapy. The way the UVB rays were falling in that part of the geographically was giving you more absorption, and that controlled your vitamin D. Now, I'll tell you why this is important with skin is vitamin D controls the way your skin is proliferating and differentiating. So, vitamin D is just not for your bones.
Exactly.
It's for your hair follicle and the way your skin is regenerating. And we all shed our skin. Very similar to a snake.
Yeah.
But a snake does it in one shot. We do it periodically. So when my face is shedding, my hand is not shedding. The skin. So you can't tell. But we're all actually shedding every 21 to 28 days. And the problem comes in these autoimmune disorders when that shedding cycle is reset. That's what's going on in an eczema. That's what's happening in atopic dermatitis, and that's exactly what's happening in psoriasis.
I love the way you've broken it down.
So, now this is why a dermatologist tells you to optimize your vitamin D because there is a role of a vitamin D in your skin regeneration and your proliferation. So, sun exposure is important for you. Do I say sunscreen is not? No. Sunscreen is equally important. Having said that, skin is your largest organ, so it's covering the largest body surface, every part. Don't wear sunscreen everywhere else. Let your body produce the vitamin D that it's supposed to, but protect your face because aesthetically, those sun rays which are great for the regeneration will also cause the melanocytes in your cells to come up. So you can develop pigmentation, you can develop tanning, and that becomes an aesthetic reason.
Got it. Yeah.
Having said that, it's more important for Asian skin. For Caucasians, it becomes even more important because you get prone to certain skin cancers. So you have to protect yourself. So in that aspect, I still say that use a sunscreen, but be mindful of a sunscreen that gives you UVA and UVB protection. Don't just follow what is written and look for a sunscreen which shows you a triple plus sign. And SPF is in no way a measure to your sun protection. It is only telling you that you won't develop probably a sunburn in those 60 to 90 minutes that you're exposed to the sun. But is it protecting you from the permanent pigment darkening or the permanent damage that's occurring on your skin? No. That's not a measure of the SPF. That's a separate parameter. And you should be an aware consumer. So you should look at it. And lastly, all that research which came out that sunscreens could cause cancer. There is an ingredient which was highlighted. Most good companies have taken care of that ingredient. And also what has to be understood is that ingredient has to reach your body in a certain percentage. It really doesn't happen with the amount of sunscreen that you're lathering on your face. But if you are sunbathing out, it's what you said, get away with 10-15 minutes of exposing your body to the sun and then put on your sunscreen because you don't want that damage, right? I can't tell you, go just make vitamin D and then come back to me for laser. I don't want to do that to you. So be mindful, and if you're aware of why you're doing what you're doing.
Super. So doctor, thanks for talking about vitamin D3 because, a year ago, I would say 1 in 2 patients that come to us every day is severely deficient in vitamin D3 and B12.
True.
Today, it's 1 in 1, every patient.
I agree with you.
And I'm not talking about levels of, let's say the reference range is 30 to 100. Okay, I'm not talking about 25. I'm talking about 15, 14 children with 6 and 7, which worries me about their overall development. Forget about just their bones, their cognitive health, their immune system, and B12 as well. Like a normal reference range could be between 200 to 900. And they're at 200 and they're fine. And then patients come and say, but it's not been highlighted in my report. And the point is you're still at the lowest range and it's falling further and further. What is the correlation that you see between these low levels? Because I know you use a lot of B vitamins and vitamin D. What is the connection between vitamin D3, B vitamins with your skin, with your overall health as
True.
well?
So it's what you said, right? I think for me also, it's literally my one-on-one. Every patient I see is deficient in vitamin D or a B12, very commonly. And I think with the new diets that have come into place, we are depleting ourselves further from this B12. You need to understand that we are dependent solely for our body to receive this vitamin through our food. Our body is not manufacturing B12 on its own.
Right.
So it needs to come through our diet. So that becomes a big factor. Having said that, I already emphasized on how important your vitamin D is for your cellular proliferation, which controls the appearance of your skin, how you are regenerating in that sense. And that becomes essential for vitamin D. B12 and in fact the whole B complex is so important for your pigment cycle, for your cell regeneration and for your hair growth. And you will be shocked to see that how many young kids with PCOD are actually showing a deficiency in a specific vitamin. So even biotin is a type of a vitamin B, right? And this whole theory came of how biotin supplements can help your hair. So having said that, we all know that these vitamins become absolutely essential for the growth of your hair follicle as well as for the skin, for the regeneration. And when we look at levels, I wish people would understand that the purpose of a level was for you to have a median value. So when the range is from 200 to 800, an optimum level for you would be a 500 or a 600.
Yes.
And that will not be highlighted in your report. But when a patient looks at it, they say, oh doctor, my level is 211. It's not highlighted. So why are you supplementing me? Which is where you need to become aware. So even when you take a supplement, it says recommended daily allowance.
Right.
That means that a certain amount should be going into your body
On a daily
every
basis.
single day.
Yeah.
And that is how you will have an optimum value. And without these optimum values, see, your skin, being your largest organ, suffers for that reason because it's also getting supplied the last, right? Your body is going to move its nutrition into areas where it seeks of high importance. Heart, brain, nerves, gut, right? Skin is where it's coming last. So if my level is already at 200, my body is going to manufacture it and send it to my nerves because my nerve health is totally dependent on my B complex. If you don't have a proper B complex, you can't have healthy nervous system. And that's not only your cognitive health, that's also your sensory perception, how your body is perceiving the heat and cold, and all of this myriad is actually controlled by a simple group of hormones and these essential minerals. So for the skin to be supplemented, you need to take these in a much higher value and they need to sit in your body at a higher value. So your vitamin D should be at a 60 for you to have a healthy skin and hair. At 6 or 7, poor thing is just going to be able to give it to your bones to make sure that your bones function.
That too not enough. Yeah.
And that too not enough. You become prone to easy fractures. Your mood gets significantly affected with low levels of vitamin D. So it's very important to have an optimum range, and that's why when you look at a value, please look at a median value. There is a reason a range is given. The purpose is to be that median value.
So that's a fantastic point. Speaking about vitamin D3 and the sun, we spoke about the sun earlier. So I'm a fan of getting sunshine, and I know everyone's different.
True.
I also know that we need to protect our skin. So like if we're getting, like, let's say right now in Mumbai, the sun's up by about 7:30. It's gentle on the skin. It's not burning. It's just a nice warmth on your skin. Could we get like about 15 to 20 minutes of that before we start putting on our sunscreen and we step out into the day?
So I would say again, Luke, this becomes very personalized. So if you have a skin condition like a melasma, like you have a tendency for pigmentation, even that 15-20 minutes will cause you damage. If you've done an aesthetic procedure or you repeatedly use, let's say, a retinol, your skin is recycling much faster. So your absorption of everything is also much more than a normal skin, right? In those cases, even 10 to 15 minutes will cause you damage. But what you can do is use a mineral sunscreen. You don't have to go in for a chemical sunscreen. You can look for a mineral sunscreen which contains a zinc oxide. So it's like a UV filter. It's like an umbrella for your skin. All we need to do is we need to make sure those rays are reflected and not absorbed. But the rest of the body is there to produce that vitamin D for you. And because of sunshine, as you said, the sunshine hormone, the serotonin, that will also be released with that amount of absorption. Because your skin is covering a very large body surface.
Or just turn around and get the sun on your back.
Yes, you will get enough of it. What you should avoid is, when you're taking those 15-20 minutes, make sure that you're not wearing black clothing. See, black clothing becomes more absorptive than anything else. So we want the rays to be absorbed onto your skin. So have your more body parts exposed so that you can still get the benefits of the sun, but it doesn't have to be necessarily on your face.
So when I'm buying a sunscreen, okay, what do I want to look out for on the label?
So I feel like first you need to understand your requirement, whether you need a mineral sunscreen or a chemical sunscreen,
Mhm.
because if you are going to be more in the water, you need to look for things which will give you more sweat protection. But 3 things which I always say is, look for the active ingredients which are present in your sunscreen. Titanium oxide, zinc oxide, these are all very easily highlighted. And look for that triple plus sign or a circle on top which will show you the pigmentation protection that you're getting. And then lastly, look for your SPF. Now, if you choose a sunscreen which is of an SPF 30, you'll have to reapply it more often than you would have to reapply a sunscreen of a 50 SPF. Okay, that's the difference between the SPF, because that 30 is showing you how long you can be out in the sun without getting that erythema or a sunburn. And lastly, apply your sunscreen correctly. Using a small amount of sunscreen is not going to do you any good. You rather not wear it. You know, so make sure you use a fingertip unit method, which means this amount of sunscreen needs to be applied on your full face. And if you're out for longer, then it has to be reapplied. But having said that, physical barriers work better. So wear a wide-rimmed hat, you know, wear big glasses. There's a reason why golfers and all those hats were developed. It's to help you protect yourself.
Okay. You spoke about retinol earlier. I'd love to speak about retinol, its usages today, the overuse of it, and also about the fact that there is a natural way for us to also, I'm not saying it's a replacement. Some people will need retinol, but I would love for you to educate our audience on the fact of how cellular turnover happens naturally as well, and also about retinol.
So, retinol is actually just a derivative from a vitamin A. That is what it is. And it's available for you to consume it orally as well as for you to put it topically. Now, the oral vitamin A which was given, which is a popular drug, you know, it goes with the name of isotroin, the salt being isotretinoin. It actually helps with your cellular turnover. It's helping reset your cell turnover. Because in all diseases, including acne, your cellular turnover is what is altered. So when you use a retinol, your cells are shedding at a particular rate, which is good for your skin. So your skin is getting regenerated and that gives you that healthy shine and glow, right? But what you need to understand is when I topically use a retinol, I'll use it only on my face. I can't lather it on my body. So if I was to consume foods and take supplements, which would actually help my cell regeneration and turnover, I would be able to achieve it more holistically. Consuming a magnesium supplement can be immensely helpful for your cellular regeneration. Vitamin D, vitamin C, B complex, just these simple things. Having a diet which encourages, that is foods which are rich in these elements. But sometimes, as I said, foods cannot be enough for the amount you need in your body. We need to take an oral supplement. Just giving this oral supplement will help to set your cell turnover rate. And a normal individual cell turnover rate is anywhere between 3 to 4 weeks. So 21 to 26 days. But because of our lifestyles and the pollution and our environment, our cycles have become 45 days, 48 days. So the skin starts looking dull. See, what you do in a facial is typically that. They remove the top layers of, you know, your exfoliation, that is all your dead skin. That's how you glow. But then why don't facials last long enough? Why do facials give you a glow only for 2 weeks? Because the dead skin buildup will happen again. So you need to reset your body from within to have that reset cycle, right? That's the only way to do it. And I feel that is the most sustainable way to do it. I'm not saying don't go feel good. I practice aesthetic medicine. Yes, once in a while you need facials. You should be using the correct creams. But I still insist on how it is important to do it holistically, because I just feel that's more long term.
Yeah, that's more sustainable for sure. I wanted to talk about vitamin E. A lot of people have started using vitamin E oil. You get this oil and they apply it on their face. You know, is that going to be absorbed into the system? And could I also eat vitamin E rich foods or even supplement with a vitamin E for that, like you spoke about retinol?
So, you know, Luke, I feel that vitamin E is very essential, but not for everybody. So vitamin E is a fat soluble vitamin, right? So when you consume it orally, one, you need to do it correctly. It has to be had with high fat foods and it should be taken, let's say, cyclically. So you take it for 3 months, give a break, and then you know, wean off it and then have it again. But why vitamin E is important is because vitamin E is very important for your collagen buildup. And it also protects the breakdown of your collagen. So as an anti-aging, I think vitamin E is one of the most essential elements which should exist in your regime. But topically, vitamin E is a very sticky oil, right? and it's working more of an occlusive. So it's trapping the moisture and making it stay. So if you're using a vitamin E product, it has to be used only at night in a controlled environment. I can't be applying that oil and moving around because that's going to attract more allergens and dust to my skin. So if you use it in the right amounts, in a lower concentration, it can be beneficial.
Oh, that's a great point because we get a lot of questions on that.
Yes. No, rosehip oil, vitamin E, primrose oil, these are all great, right? Out of which rosehip oil has shown the maximum benefits for collagen. So if you see why these things became popular for stretch marks, is because they help with collagen. So there's a very logical answer to all of it, but it's just that we don't look into it. You know, we just say, oh, stretch marks, use this. We don't try to understand why or how is it helping. And if it's helping you by applying it topically, imagine how much it will help you if you were to consume it, right? Because topically, how much will you absorb?
Correct, yeah. You spoke about, we spoke about skin, and you know, we have a lot of cases like you do, eczema, psoriasis, and acne. Now, when it comes to makeup, I'm not against makeup, but someone who already has a problem, applying more makeup over that. And I understand, I mean, everyone has their own reasons. I mean, you're a teenager, you don't want to go to college with your skin looking bad, so you cover it up. But is this doing more damage? Instead, is it helping, you know, I mean, because obviously you're absorbing more of the chemicals which are in makeup. Is it coming in the way of, and people staying in that vicious cycle of not getting better? How would you advise people to get through this?
Yeah, so I feel like with acne, what's very important to understand is that when you develop acne, it's a bacterial infection and it is impairing your skin barrier. So your skin barrier is broken. That's why there are those wounds, whether they are pustular acne, whether they are nodular acne. They are openings on your skin, which means you're going to absorb anything in a much higher quantity than an intact skin, right? So whether it is the outside allergens, which is why acne becomes red and inflamed as well faster. People develop sensitive skin with that. And at the same time, when I'm applying makeup, my absorption is more than an intact skin. So when you have acne, you want to camouflage. You know, you are conscious and it can affect your self-esteem. So I don't say that don't use makeup. What I usually tell my patients is look for the right ingredient. So using a more mineral makeup at the time when you have active acne is advisable. Secondly, cleansing it off, because keeping it for short duration will not cause you as much harm as it would if it was to absorb into your skin over a longer period of time. And double cleansing in these cases becomes very important. So it's important that you use a micellar water to make sure that you get all the dirt and grime off your skin, and then to ensure that you use a pH balancing face wash. Because when you have acne, your barrier is impaired. So your pH is also impaired. And when your pH is impaired, you're attracting more bacteria onto your skin. Because your pH is what is keeping your mantle. It's what's protecting you. It's not allowing certain organisms to grow on your skin. And this is why the pH of the skin is important. Right? But topically alone, again, it's not enough. You have to have a pH balance from within.
So I love how you keep coming back to diet.
Yes.
PCOS, you mentioned this before, and we're seeing this in young girls today. We're seeing all of these problems start to happen. They're put onto oral contraceptives. Again, not against it, but some of them are on it for too long, which in turn, everything has a side effect. I mean, even young newlywed women are kind of given a warning that, you know, don't use oral contraceptives all the time. You need to give your body a break or figure out safer ways of having sex. But it's easy for a young teenage girl to be put on it for months and months and months.
Oh, we see so many of cases like that.
How can we navigate through this situation? Because I am seeing a change in lifestyle as one of the biggest causes. More junk, ultra-processed, late nights, peer pressure, genuine problems that a kid has, which is also leading to a hormonal imbalance. But how can we navigate through this whole oral contraceptive way of looking at it?
I agree with you. I think PCOS has just become so common. And on that note, I would like to highlight that, you know, sometimes even if your period is regular, you have a regular menstrual cycle, but you are showing symptoms. You have acne, you have abnormal hair growth, you are shedding hair from your scalp, darkening of the neck, darkening of the underarms, and you feel like your cycle is regular and I'm not fat. So it's probably not PCOS. See, there is a variant of the PCOS, which is the lean PCOS. It's become very important for us to understand that why has this occurrence increased in the first place? How come earlier there weren't these many irregularities? Which brings us back to the fact that definitely diet and lifestyle has played a role in this occurrence. And in that aspect, honestly, in medical terminology, PCOS is a lifestyle disease,
Correct.
which means it can be reversed.
Mhm.
So the good thing is, it doesn't have to be only treated with contraceptives. It
Mhm.
can be reversed with your lifestyle and your diet.
Mhm.
In PCOS, your ovaries are producing more male hormone.
Mhm.
And normally this male hormone exists in all the females, but it's at a certain concentration, and when the body tells it, it signals into producing the female hormone.
Mhm.
But in PCOD, that signal doesn't come. It's just producing higher and higher amounts of the male hormone, which is leading to that acne and your hair loss and the darkening.
Mhm.
Now, what would you typically do? You think, okay, if the male hormone is high, let me give a synthetic contraceptive pill,
Correct.
because that's the best way to balance it out. And I'm not saying in some cases it's absolutely needed,
Yeah.
and that's the only way it'll work. But you have to think about it, that till you supplement it, it's fine.
Mhm.
When I remove it, that male
What's
hormone
gonna
is still
happen?
sitting
Exactly.
here.
Yeah.
So how will the body ever learn to produce its female hormone?
Yeah.
And that is where your diet and your lifestyle becomes more important,
Mhm.
because one of the major factors for that male hormone to be high is your insulin spikes,
Mhm.
which is why they tell you to go off dairy.
Mhm.
See, a lot of people think that telling them to go off dairy is a fad. No, it's not a fad. There is a very important role which has been seen with dairy and your insulin growth factor, because now the dairy that's coming to you is laden with hormones. The cows are being injected to produce that kind of milk, and you are ingesting it,
Mhm.
right? That is why this disconnect has to happen.
Yeah.
And when you eat, a lot of PCOS girls go on these intermittent fasting. I see so many of them. And then when I ask them, what did you break your fast with? It's a carb-laden diet. You broke the fast and you made your insulin spike. You made your PCOD worse rather than
And
helping
took
you.
away the effects of the fasting that you did.
Yes.
Yeah.
So it's very, very important that we learn what are the right ways to eat
Mhm.
and what is suitable for my body. Whether my body is good at carb metabolizing or not, whether I should be eating it or not, right?
Mhm.
It's not, we can't just follow one thing. This has to be customized.
Yeah.
And that's the only way. And when it comes to PCOS, I feel for skin, inositol, zinc and B6, these three supplements have been a game changer
Mhm.
for your skin in PCOS, because it's all balancing your insulin. It's all bringing that insulin level down. It's controlling your hormone, and as a result of which you can have acne-free skin. Your hair starts becoming healthier, and the other problems which are coming with PCOS in your skin get altered, because that acne is happening because of that excess hormone,
Mhm.
male hormone in your skin. Your hair loss is happening because of that excess testosterone.
Yeah.
So we have to find a way to control it. We have to find a way to control it and to be able to sustain it. If I just put you on the pill, when I withdraw the pill, you're still at where we started. We didn't change any of that.
I love that you keep talking about insulin, because that's another big issue today. Insulin resistance in so many people. And yet most are still looking at just an HbA1c. You're fasting in morning.
I agree with you.
Now we've started doing more home IRs because it's
Yes.
telling you straight up, and you won't believe the amount of people who are insulin resistant, leading to pre-diabetes, all of that. And it turns in, connection with everything, skin, hair,
true.
and all of these problems.
Insulin is one of the most important hormones for your skin, and
Mhm.
people don't look at it. And it's again, we go back to the testing. You check the range,
Mhm.
and you're sitting at anything above 10 is going to show as a bad thing on your skin. But people will not treat it till it's 25, 26.
Yeah.
So everyone who's coming in that range between 10 to 20 is still
Missing out,
suffering because of the effects of the insulin on the skin, but is not being treated. And I can give you gels, right? You have acne. Because of the bacterial component in the acne, the gel will help you.
Mhm.
But the minute that bacterial component is taken care of, the hormonal part will still be there,
Yeah.
which didn't get corrected, and you will still have acne. So people say, oh, acne is a vicious cycle. It never leaves you. No, it leaves you. I had horrible acne prone skin. I had PCOS myself,
Mhm.
but there is a way to reverse it,
Mhm.
and I did it without contraceptives. I have 2 healthy kids now. So there is a way out, but you have to make that lifestyle choice.
And be willing to put in a
And
little
be
bit of
willing to
work.
understand
Yeah.
that medicine is holistic.
Yeah.
You come to a dermatologist, but there is still an holistic approach to dermatology.
Right. What are some of the myths that you see in your day-to-day? Like, break a few myths.
Oh
for
my
us.
God, myths. I think the first thing I have to start is with oil cleansing.
Mhm.
Okay, I saw abundance of patients coming with these blocked pores and comedones, and after a period, I started understanding the pattern. They were all using coconut oil to cleanse their skin.
Mhm.
And you need to understand, because oil cleansing became popular, right? Now, oil pulling and oil
Yeah,
cleansing
are
are
two
two
different
different things. And this is what people need to understand. It's a very basic thing. So if they said, Luke said oil pulling is good, yes, but Luke said oil pulling is good internally. He
Mhm.
never said, go put that oil on your
Face,
skin.
yeah.
And coconut oil is great for dry skin.
Yeah.
It's one of the best moisturizers that exists. But it's not great for sensitive skin. It's not great for somebody who's prone to acne, because that coconut oil will further block your pores. So, simple things like this can be a problem. Don't eat sugar, eat fruits. So many of my patients, they said, oh doc, I've gone off sugar. I'm only eating fruits. Which fruits are you eating? The list comes out, right? So they don't understand that just because I said don't eat processed sugar, you still need to alter the forms of sugar. Same thing with milk. Again, I said milk can cause acne in a lot of people, but not in everybody. Whey protein. Whey protein is a big problem with skin. I see so many people, because they're on these diets and they want to lose weight for their PCOD. And I'm seeing that the PCOS, in some levels they are feeling better because they're also on medication, but the skin is still acting up. And then when you take their history, they're consuming a whey protein.
So move to a plant-based protein.
Plant-based protein is very important. Especially, I feel that if you are not somebody who's into heavy weightlifting, where you can burn that testosterone which is being built in your body, you need to go off that whey, because that whey is causing an IGF problem for you. Or you need to be more prepped to consume that protein. You need to use a hydrolyzed version of it. You need to see something that has unbranched amino acids, so that your body can use those amino acids. As I said, your collagen buildup, your hair follicle, your skin, it's all protein. All protein. So you need those amino acids in your body.
In fact, a lot of, since we were talking about collagen earlier, a lot of people who come to us and want to be on collagen, when we look at their diets, they actually need more protein and collagen.
I agree with you.
They're so protein deficient, and only by fixing their protein, they never really need collagen. That and good sleep, and they're better.
Yeah, I feel like if you do a study for people who consumed collagen and who consumed plant protein with the right form of amino acids, I think the ones with the plant protein will show you a better collagen rate than the ones which are consuming oral collagen, because you have to understand collagen is a very heavy molecule. It just can't be digested by your body so simply. And when we apply topical collagen, the role it's doing is just plumpening, because it's absorbing water. It's plumpening your skin. It's not actually increasing that count of collagen. There are very few creams that would have passed a study to actually show that. So having said that, hyaluronic acid to be applied topically, retinol to be applied topically, certain collagen serums, yes, they can help, but you have to understand the role that they are helping with and till what extent can they help, right? So I love retinol. I think it's a great product to be used, but it has to be used correctly. And if you're using retinol and then going in sunbathing, you're causing more damage than benefit. And having said that, I didn't say this point earlier, the lights that we all are exposed to and the amount of times we keep our phone next to our face, that even just with that blue light, you need protection. You need your sunscreen on your face.
So that's why they say you should wear a sunscreen even if
indoors.
You're
Yes, it's very important, because looking at a room like you and me are sitting, this is a well-lit room. Any room which doesn't need artificial light for seeing each other, that means that's natural light. And with our current rate of damage on the skin, even that much light is enough to cause sun damage and your collagen breakdown. So we need to be mindful, right? But we have to have that balance. You use the correct sunscreen, you use it appropriately. At the same time, you give yourself enough sunlight as well for the rest of your body, so that your vitamin D and all is still optimized. And when it's not, you take the supplement the way it's supposed to be done, so that your vitamin D is there to help your cells regenerate.
I was on a long Mumbai-New York flight, and there was this air hostess. We were talking, and she had the most amazing skin, and I asked her about it. And she said, I'm off to put my sunscreen now. And I said, we're on a 16-hour flight.
No.
She said, yeah, but the circadian rhythm's changing around. Look around, there's all LED. There's no natural light for the next 8 to 9 hours. And even then, people will keep their windows shut. And she said, I use it on all my long flights.
I would love to meet her.
There's no sun.
She seems
was actually using sunscreen on that flight.
See, and that's the beauty of it. When people are that aware, I actually feel very happy, because I feel like you're becoming so aware as a consumer. And you should be aware as a consumer. I always tell my patients that read your ingredient list. See what you're putting on. See, we are all exposed to so much xenoestrogens. We've drank out of plastic bottles. We've applied makeup which was probably not the healthiest.
Perfumes,
we do
fragrance.
perfumes, we color our hair. We are exposing ourselves to xenoestrogens on a daily basis. By being a little aware of it, we can make that shift. I read an article about a simple thing about having ionized water and how much, how people say have 8 liters of water in a day. But if that water is not also being absorbed, you're not getting the minerals of the water. So a lot of times when we're using our RA purifiers, that water which is coming to us is actually coming more laden with minerals, which is why people notice this shift. Often they'll come and tell me that, doc, we shifted and our hair fall started. It's a simple thing like water. So, if you go to see, Luke, skin and hair problem has become so prevalent that is just all around us, and it's a lot to do with the choices we are making. But what I feel is that by making these simple hacks, like as I said about water, just having ionized water can also be a game changer. It can be, and you don't have to do much. You just have to use that same water and expose it to sunlight in a glass water bottle, and your water will get ionized. And that's good for you. And hydrating yourself with even 4 to 5 liters with that will give you much more benefit than anything else.
Oh, that's a brilliant point. I mean, Doctor, I am going to have you back on episode 2 because
Definitely.
There's so much more.
I know.
I need to speak to you about so many more myths to break. But before we end, this whitening, skin whitening in our country, it's put people into depression. It's broken up marriages, prevented marriages from happening. And there are creams in our market that, unfortunately, a lot of Bollywood, they kind of take these advertisements and they send a wrong message to people. What exactly is happening with this whitening skin? And secondly, a lot of people go for glutathione. I know it can make a difference. We have patients who go through radiation for cancer, and then small dosages of glutathione post that helps them to get some of their skin back. What's your take on all this whitening that you see in your practice?
Luke, honestly, I'm so glad you spoke about cancer, because glutathione was tested in liver failure patients. And it was done because it's actually a support for the liver. So your body naturally makes glutathione, but because of the stressors, and if there is an active disease, our glutathione production in the body is decreased. And what that glutathione actually does is, it's working on your pigment cycle, right? On your melanin pathway. And when these patients of liver failure were seen, it was seen that their skins appear darker. But if you go to think of it and you really break it down, it's not the glutathione, it's the lack of liver support which caused that skin darkening. So if you want to have bright skin, support your liver. It's as simple as that. So you take good supplements with milk thistle, you supplement with dandelion root teas, you have a diet which is supporting your liver. Don't consume as much alcohol and laden your liver with it, and you will have glowing skin. But having said that, glutathione alone can never give you skin whitening. It is a pure fad, and I would say it openly. Whether you take it IV or whether you take it orally, it can help you because it's an antioxidant. So it will get rid of the free radicals, it will prevent the collagen breakdown, and it can make your aging slower. Yes, but when done in the right dosing and in combination with its precursors, like taking a NAC or a vitamin C with it. Glutathione alone is not doing you anything. So even when you do it as a treatment, it should be done in combination, and it needs to be understood. And I usually tell patients, please stay away from these whitening creams. I won't take a name, but there is a very popular brand which was actually going through a major lawsuit case for it, because people used it for a very long period, and when it stopped, their skins were seen to have a condition called as ochronosis, where you become grey, and then there is no treatment. So please stay away from whitening creams. They contain, and any ingredient which points out to a hydroquinone, do not use it without the supervision of a dermatologist. It's very, very important.
I read this interesting study, because we're always studying melatonin and its role in cancer, because, I'm a huge fan of deep sleep. It does half the work that, people are looking for complication. And one of the precursors of glutathione is also melatonin.
True.
Which is why that melatonin puts us to sleep, moves on to do its job in the body, but also stimulates glutathione for liver repair while we sleep.
And melatonin is really, really useful. And it's what you said, right? So it's the circadian rhythm. So melatonin would naturally be produced if we would follow it. But why for skin it becomes important is because there's this hormone you release in the morning. One was your growth hormone, which is helping you repair. But there's a very essential hormone called prolactin, which in a lot of PCOS cases, people don't look into, but it's an underlying factor. It's a stress hormone. It's indicating, it goes very high.
That's why people can't conceive when their levels are too high.
And when this prolactin goes out of whack, your skin could break out into so many problems at the same time. Like you would have blackheads, you would have whiteheads, like all types of comedones. You would have the most complex acne, which is not responding because the underlying factor is getting proper sleep and taking less stress.
Dr. Sonali, this has been amazing. Thank you so much.
It's my pleasure. Thank you for having me.
We're going to come back on episode 2 whenever Doctor's free again. So we're going to talk more about hair. We're going to break a couple of more myths. And we're also going to go into simple lifestyle changes that we can all make, to start looking at better skin and better hair.
Yes.
Thank you so much for your time.
It was my pleasure. And I look forward to speaking to you soon. And yes, for sure, we'll talk about hair. Yeah. A lot of people out there are balding.
Thank you so much.
Thank you. Thank you so much.
Stay tuned for more. We're going to continue our journey, learning, sharing, and evolving.